Good afternoon. Today we are doing Oroantral Fistula closure surgery. So, what is Oroantral Fistula? It is basically a communication between mouth and the sinus. So, symptoms of oroantral fistula is there is a frequent regurgitation of fluid and air inside the maxillary sinus, and it comes out through the nose, generally fluid. That is the primary complaint, and if it is a chronic problem, it will lead to chronic maxillary sinusitis which bothers patient. Definitely the nasal regurgitation is the major issue with the patient. So this is like rarely happens with after dental extraction, particularly on the posterior side, molar, premolar region, especially when there is a traumatic extraction or when there is a pathology, at the apex of this teeth. So after traumatic extraction of or there is a pathology after extraction, it leads to opening. Sometimes it goes undetected and the proper treatment is not done at the primary phase, and it ends up with the oroantral fistula. Many times it's secondary to some pathology like infection or cyst in the maxillary region, which can lead to oroantral fistula. Sometimes some tumor can lead to oroantral fistula. So in general, we commonly see cases post dental extraction. So today also we had a similar kind of a case post dental extraction. She had two attempts of fistula closure because this surgery is quite challenging. So today our plan is to do 3-layer closure. So we are planning first to dissect the labial flap, buccal myomucosal flap, and then we will try to dissect the sinus lining, and we will try to close the perifistula lining, and we'll try to push the sinus inside. Over that, we will put PRF, platelet rich fibrin. Over that, we'll put the buccal fat pad, and then we will close defect primarily by advancing a buccal myomucosal flap. So this is the plan for the surgery.